So most patients treated for thyroid cancer never experience recurrence. There are some cases, though, when cancer can return after many months or even many years after treatment. This happens in less than 5% of the population. So when thyroid cancer comes back, there are often still very effective treatment options. So let's talk about when recurrence happens, how doctors detect it, and how it is treated. So when thyroid cancer comes back, the most common place it appears is in the lymph nodes in the neck, right here. That's the most common site. It can also come back in the thyroid bed, which is where the thyroid gland was removed. Less commonly, thyroid cancer may spread to other parts of the body, such as the lungs or the bones. Now, how do we detect recurrence? One of the most important blood tests is a test called thyroglobulin. This is a protein that is made by thyroid cells. So after the thyroid gland has been removed, we monitor this protein. And as we see rising levels in the blood, that can suggest and signal recurrence. Doctors also use neck ultrasound that allows us to look very closely at the thyroid gland, thyroid bed, and nearby structures such as the lymph nodes. And in some cases, we may use advanced imaging techniques such as CT scans or PET scans. So when thyroid cancer returns, the treatment depends on where the cancer has returned. If the recurrence is limited to the neck, the first approach is often surgery, which is where we remove any tumor or lymph nodes that we see. Some patients may then get additional treatment with radioactive iodine therapy, especially if the cancer cells still absorb iodine. And in some situations where surgery or radioactive iodine is not possible, radiation therapy can be considered. All right, so radioactive iodine is a very important treatment for many patients because thyroid cells naturally absorb iodine. So when the cancer cells absorb iodine, which we can see here, that there's signal in the neck right here, we can use radioactive iodine and it delivers targeted radiation, which will then destroy those cancer cells. However, sometimes the thyroid cancer cells may lose the ability to absorb iodine, which we see in this instance, we do not see any dark shadow around the neck. So when that happens, radioactive iodine may become less effective, so we consider other treatment options. But even when radioactive iodine stops working, treatment may not be needed immediately because many thyroid cancers grow very, very slowly and can remain stable for many years. We can continue monitoring with scans and blood tests. The reason we start treatment is because the cancer continues to grow or causes symptoms. So these are the situations when medical oncology typically gets involved. If the cancer spreads beyond the neck to other organs, or if the cancer stops responding to radioactive iodine, or if surgery and radioactive iodine are no longer helpful. So in these situations, systemic treatments such as targeted therapy may be needed to control the cancer. So in the next video, we're going to discuss the treatments that may be used when thyroid cancer no longer responds to radioactive iodine.